I'm audible and everyone is able to get me, but I think I can go ahead. Thank you so much.
No,
My name's Namushi Wamulume. I'm a Bachelor of Science in Nursing student with Taxila University, and I'm here to present on the effectiveness of a nurse's continuous professional development. This is a research project that I carried out at Lewanika General Hospital. And a little bit of just background and information. In 2016, the General Nursing Council of Zambia introduced a new relicensure system, that requires nurses to earn, a minimum of 20 continuous professional development credit points for them to be able to, get a license again. And they earn these points by participating in learning activities. So continuous professional development is a process by which nurses engage in to maintain, improve, and broaden knowledge, competencies, and skills. For them to be able to retain their capacity to actually practice safely, effectively, and competent, as well as from a legal point of view. A summary of my research project: the new relicensure system of continuous professional development also comes with an important aspect with it, which is skill set maintenance and update for safe and competent service delivery. However, this aspect has been neglected and needs emphasis on. So this study was done, to evaluate the effectiveness of the system in skills and management upgrade for quality improvement purposes. Recommendations for betterment of the system have been, alluded to and explained later on. So why the study? The world is changing, and medical practice is changing with it as well. And so is nursing as a profession. It is hoped that the study is therefore going to contribute to the knowledge base of nursing as a profession. This study was conducted with intent to raise awareness on the significance of the honesty, continuity, relevance, as well as application of continuous professional development, for purposes of maintaining, developing, updating, and increasing knowledge, skills, attitudes, and competencies in the everyday patient nursing. So nurses in almost everywhere where you're going to go, nurses are often the first and sometimes the only health professional that people are going to be in contact with, for health service delivery or health care. And continuous professional development allows for that particular nurse to maintain knowledge, skills, and competencies attained from formal education, and also continuously improving, broadening, and updating the knowledge, competence, and skills if gone about the right way. And this system must be evaluated from time to time to establish if it is still fit for its purpose. And as it stands, in Zambia particularly, there has been no re-evaluation of this system of continuous professional development. So that was an opportunity for me to say, okay, I can actually do this research. The methods that were used, descriptive cross-section research design, to ensure that the evidence that was collected answers the question, how effective is a nurse's continuous professional development at Lewanika General Hospital? And this can be also applied to other parts of the country. Data collection was done through a questionnaire with open-ended questions, and this questionnaire also, had consent, and there was also a review of equivalent number of continuous professional development logbooks for the nurses. This is just, to show you how the results came out. Questionnaire results showed that most of the, learning activities that nurses engaged in were HIV-related topics or trainings, and this is because of, a donor-driven, kind of continuous professional development. The second most conducted learning activities were those in line with maternal and child health, and then followed by neglected tropical diseases, and then other kinds of, learning activities. And then, a review of the continuous professional development logbooks, showed that most of the trainings that are conducted are donor-driven, and that they were followed by clinical, presentations. And lastly, and very unfortunate, is that self-directed learning activities were not very, very much, conducted by the nurses, which shows that that the quality of the effectiveness of a nurse's continuous professional development at the general hospital is poor. The system has quite a lot of gaps that can be breached and need to be breached, with enough room, and opportunity for improvement to achieve the initial purpose of its introduction by the General Nursing Council, which is also skill set maintenance and update for safe and competent delivery of nursing care, as well as license renewal. And this is applicable to the rest of the country. So my recommendations, for the future, based on the findings of the study, is that to better the continuous professional development system, nurses have to be oriented on the purposes and principles of continuous professional development, and then also encouragement of nurses to engage in self-directed learning activities, and then the validation process to be reinforced and done only when there is actually evidence to say one has actually conducted or engaged in a learning activity, by providing, practice-related feedback. And then also encouragement of nurses in line with honesty throughout the validation or verification process of continuous professional development. The other recommendations that I've made is encouragement in line with continuity of continuous professional development, and that learning activities must be planned for and conducted in line with learning needs to promote relevance of these learning activities, because it's actually useless for someone to go for a training that is not going to be practiced. And then the monitoring and evaluation of implemented activities needs to be invested in and conducted vigorously and very keenly, so that we know what the fruits of continuous professional development are for our patients and in service delivery. and then continuous professional development to be included in the nurses' individual work plans. Thank you so much, everyone, for the support.
Okay, dear participants, now we are moving into polling session. Please poll for Mr. Namushi on the title of a qualitative investigation of the effectiveness of nurses' continuous professional development.